there are two basic types of valvular lesions. Okay? You can have stenotic lesions or regurgitant lesions. And so in terms of stenotic lesions, this really affects valves that are open, should be open. The gate should be wide open. And there's some lesion or some issue, calcification or whatever, that's causing blockage of the gate of that valve. And so as the blood is ejecting through it, it's going to create turbulence. And that turbulence is going to create a murmur. And eventually it's going to create problems for patients. On the other hand, regurgitant lesions affect valves that should be closed. When the valve is completely closed, no blood should be flowing through it at that time. But if there's an issue where the valve is leaking, then you're also going to create turbulence at that time, create a murmur, and then also additional heart problems for the patient later on down the road.